A bit rough last couple of days, as said previously. Feeling a bit better today, so off we go. Bit of fresh air to try and take Brian the dog for a walk. Short flip around circuit into Bridgeford. We'll see how we go. Beautiful day. Still full of cold, but feeling a hell of a lot better. Monday, Tuesday, didn't really get out of bed. Yesterday just lounged around, couldn't bother to do anything, and off we go today. Quite a busy 10 days coming up or so. I've waiting on a call off the oncologist on Friday. Came back from a little break in Skegness early got the phone call to say that the doctor's still a little bit concerned with protein levels in my good kidney, which has been a bit of an ongoing thing. Not sure it's actually not coping very well, but protein levels have not really dropped since after my operation, so I'll await those, and then beginning of next week I'll have another blood test. I've got where are we date wise? 14th, early part of the week, a blood test pre my next immunotherapy treatment, which I think is on the 18th, which I'm hoping again. The last couple of times they say they decided to continue with the immunotherapy treatment despite those proteins and bloods not being perfect. Whether this time they decide to give me some adjustment, hold back, which I don't really want to do. I obviously prefer to keep that treatment going. Still at the back of your mind that you don't want it spreading, and by that obviously I'm talking about the cancer spreading anywhere else. Constantly in my mind, every time it's a blood, waiting for those results. I guess it's natural that you're thinking, you're hoping, you don't want to hear the words. So that'll be on the 18th, subject to those blood tests. Well, pre that, and obviously the phone call tomorrow at 11:45. If doctors on time, appreciate they're always very, very busy, and it's in between whatever else they're dealing with. Then I've got a scan on Saturday morning, which I think is the 20th. Again, following on from these, last couple of bloods, really, down in the pelvic area, but again, back up, I guess. I'm guessing, because sometimes they don't always ask the right questions as to why, whatever, but they've obviously got their eye on whatever's going off, and hopefully that don't show up anything that we don't want to see. And then on the 24th, another minor operation, another 6 weeks recovery. So yeah, it's going to be quite a busy week. I think also, well, I find it building up to this next treatment, just get even more tired. Don't feel great, or certainly on the first 4 or 5. It seems to go in those dips just before and just after, and then you get the best period in between, the before and after, the bit in the middle where everything seems to settle down if it's been okay. So yeah, can't imagine there be anything new with that at this moment in time. So we find we have to plan things generally around the bit in the between where I'm not feeling too crap. It's still go out and try and do things and keep normal life. Take Cutie, Amelia Rose, that is my daughter, 14, to the, well, try and give a bit of normality, go to the football in a fashion. Last week we went to the ice hockey to bear it up. Been to the cricket sort of thing, but it's a case of quick in there, out there, try and get the most accessible seats that we can get, which isn't always possible, particularly the football. So obviously those things, those times are very important, as well as time spent with Cutie. Not sure how far we've walked, but certainly a few 100 metres, and very heavy on my breathing, on my chest, but again not being able at the minute because I'm quite bunged up still. But still, keep trying, keep pushing. Every time I go to that hospital, it brings back the news into your head and you run over the thing. My dad also had cancer at the City Hospital as well, which didn't really help. That was his birthday earlier in the week as well. Quite a lot of his years passing there. Nice little cafe here in the park, which if I'm feeling particularly bad, I might have a sit and have a coffee just to break the walk up for a little bit of a rest. Particularly in the early days. Early days, not so long ago really. But I've generally been finding I've been able to make the loop in one hit, which is obviously good progress that I'm pleased about. Albeit every little bit, small steps. But obviously still a long way from, well, I was going to say normal. What is normal? This is the new normal. Didn't bring any water either. It's not the smartest move. But yeah, bit of a rush. House is a little bit upside down as well at the minute. Emma's having a bit of a home office, morning, home office working area put in. She's given up her office and working from home, as she's been looking after me for the last 9 months, which is quite amazing. So she's Busy looking after that at home today. Brian, come on then. Come on. Good boy. Best behaved dog. Oh, those clouds can do one. No, come on. No, we're not resting today. Straight through. Yeah, there's always something that's coming along next with regard to the treatment. And again, you've got to, at this point, say what a, you know, the NHS, for all it gets slagged and slated. Yeah, what great people. Everyone that I've met on this journey there, and I'm sure lots of people are the same. They're just so hard working. It's really is incredible. I'm always, I don't know what the word is I'm looking for here, but just impressed with how well they dedicating to the work. They're just non-stop. Nurses incredible, friendly. It's yeah, should be proud of the NHS. The first time I entered there, I felt they were the right people. Particular the urologist gave me great confidence. Really nice guy. That I stuck with the NHS instead of going private. Not that it actually caused me any delay, because it didn't. I mean, from going in and late December, operation within 4 weeks, which was incredible, and that was only delayed because I had to have iron infusions because my bloods were that shot. So yeah, I'm quite proud of the NHS. Birds is looking quite busy. A few people inside. Maybe that's good. It's just a little bit fresher than it's been lately. A little bit of a nip in the air, but still glorious. We're on the return leg now. Making our way back. It'll be a case of a bit of a coffee, a bit of water, settle down and see how we are. I expect to have an hour or 2 hours sleep, which is fairly normal for me after the walk. Good boy. Come on, good boy. Brian on his best. No, spoke too soon. Brian nearly on his best behaviour. Book early sale. Tui, that'd be nice. So, as normal, as I'm 31 minutes in now, beginning to feel the pace a bit. Probably start slowing down from this point. Normally around this zebra crossing. Yeah. Well, fitness class going off there at the church hall. Not quite there at that level yet. Something I've got to start considering. But trying to find that balance. If I seem to try and push myself too far, I just wreck myself. So maybe all in time, last urology, saying still major operation, that still early days, but it's hard to get that in your head because it feels a lot longer, particularly being so poorly before the operation. But in my head everything seems to begin after the operation, which of course anyone setting out on this journey will know you've probably been feeling like rubbish for some months without actually realising what the hell's going off. Which certainly was the case with me. I mean, I visited my doctor 10, 12 times maybe. Oh, the dog's just giving me one of those little... You're wondering why I keep twisting around. It's because I, one-handed with obviously having the camera today, his lead gets tangled. Yeah, you know, you go through that period, you know something's not quite right, but you're not sure. I myself, say, was going to the doctor over quite a period, and he was concluding that it was, you know, just an infection. Wouldn't give me any antibiotics in the beginning, although we did go down that route eventually as I got really poorly. I even had an X-ray the February, literally a year before, sent me to the hospital and just X-rayed the top of my chest for some reason. I suppose thinking it was a chest infection. When if they'd have done the whole body, they'd have probably seen that my kidney was the size of, well, whatever. I don't know what size it would have been then, but it's certainly an issue that it was big enough to give me a non-stop cough because it was pushing on my esophagus. I think that's what it was anyway. All the signs were there, but for whatever reason it didn't get picked up. Oh dear. Sun is absolutely gorgeous, and I've said that a few times, but it's so nice on your face. But of course, all those times that I was laying on the settee, laying in bed, not moving for months on end. This is just obviously a blessing to be out, and I guess that's one of the targets that, you know, you sort of dream of, a bit of normality and opportunity to enjoy. Yes, certainly spent some time staring out my bedroom window. Most of the time in agony, begging for some morphine. So you do have the tools to cope with it, but it can be challenging in your head at times. But also my particular case, just so tired and so much pain post-op, but you know, you try and get prepared for, but yeah, you need to set out with a mindset that it's going to be, well, a long recovery, longer than you think, and certainly longer than what I thought, even though, you know, I had a reasonable expectation. And again, those things that you mentioned before, people see a photo on Emma's Facebook. As I say, I just don't post on there, which is very strange that got the motivation. Well, I have got the motivation that hopefully it'll help people at the start of the journey and those that are just interested to follow the journey. You know, the post of ice hockey, for example, or at football, or on the beach. Picture don't show the story. You need, you know, as I say, walking down, you've got to try. I personally try and keep that normality for QT and do the things that we did before, but it's just not as we did them before. So, yeah, you can be fooled that you're out and everything's okay, where it's not, and when you get back you're absolutely knackered, and it's there, taxi back and done literally, which generally for me means out cold till 9-10 o'clock, normally the latter if I've been out to the hockey. But obviously you'll get those people that, nothing wrong, saw you out there, everything good. Well, no, not really. But so be it. Good boy. Nearly back at the end of the road. Wait. Good boy. Back at the end of the road. Wait. Yeah, hopefully once this is cleared, I'm going to try and get to some classes at the gym, try and get some movement back in this left side. Probably ask at my next appointment, actually, although they have said that exercise has been proven to be very good for you post-op. That's not medical advice, obviously. None of this is intended for medical advice. No medical profession. Oh dear. This road does seem like it's so long we're coming back. Ready to get back now. Nice steady amble. Not really walking, more ambling along. But we'll try and build that up over the winter. So, I think I'll catch you later. Not really a lot to add. I'll pick this up soon.